Well, welcome everybody. This is so exciting. Today, our guest is Dr. Mary Margaret Holmes. She's a PharmD and she is the founder and CEO of Pharmhouse FM and functional pharmacist, and she's a functional pharmacist. So welcome, Dr. Mary. Thank you so much for coming here today.
Thank you so much for having me. I'm so excited.
I will say this a couple of times through our talk today, but if anybody has a comment or question, please put it in the chat room. Dr. Mary Margaret Holmes would love to answer anything that we can throw at her, and we'd love to hear from you. So, oh my gosh. So you are a PharmD and you own your own practice. Can you tell me a little bit about how this started, what you were doing? Yeah.
Yeah, I'll try to make it short and sweet, but I grew up in a very Western medicine inclined family. My dad is a pharmacist. My mom's sister's a pharmacist. My mom was a nurse. I'm the fifth pharmacist in my family, actually. So very kind of deep into Western medicine. My dad actually worked for a major pharmaceutical company for 40 years. So that was kind of how I grew up. So I kind of went that pathway into pharmaceuticals and went and got a Doctor of Pharmacy degree. Always loved working directly one-on-one with patients. And then I spent about 16 years as a retail pharmacist, and I did love my job, but as a pharmacist, you start to see patterns year after year. And one of the things that I didn't love was that we did a lot of symptom treatment and not a lot of my patients fully healed. Which was a goal. And so then I guess it was about 16, 17, I had started to transition a little into more functional type medicine, spend a little bit more time with my patients. And my mom was actually diagnosed with colon cancer. And that really threw me deep into the functional integrative side. Because we knew what the outcomes typically looked like with Western medicine. And I wanted to be able to support her in every aspect that I could, especially from the natural side of things. And so I just deep dove into that head first. So that was kind of the pathway. It was a little slow because I was raising 3 children and, but eventually we got there. So, yeah.
Tremendous journey, like you said, especially while you were raising three children and working and with a sick mom. That's incredible. Could you explain to everybody once again? I think a lot of people know, but what is functional pharmacy? You were saying that you took the deeper dive into functional pharmacy. So what is that?
Right. So basically, I took a strong left turn out of retail pharmacy and into functional pharmacy, which is a lot of consulting. Basically, what I do is I meet with patients one-on-one, and we spend a lot of time together, and we deep dive into their health history, their most pressing concerns. I ask lots of questions because we want to get a very good roundabout idea of what's going on so that from a functional pharmacy perspective, we can get a plan together on what the best way to approach that particular patient's issues is. And that could be anything from filling in some treatment gaps, from supplementation, herbal type stuff, to things like pushing towards more things like physical therapy, chiropractic therapy, just therapy in general, mental health therapy. Really multifocal approach. But from my end, because I'm not a physical therapist, is more the herbal supplementation part of that. And that can be integrated into with Western medicine as well, or we can do it by itself. We also do tons of functional lab testing. So this is a deep dive into things on a cellular level. And of course, with a lot of people don't know this, but PharmDs, we are taught diagnostics just like an MD. So we do a lot of lab testing and get into the diagnostic side of things to treat any underlying issue that may be connected to a patient's particular condition. So.
I honestly did not know that about PharmDs either. So that's very interesting. And
Mhm.
I'm sure it feels really safe to patients once they know that too, right? That you actually have the
Yeah,
training behind you. Yes, yes.
yeah.
Oh,
Mhm.
wow. So what type of conditions do you commonly see in your practice, and how does the functional pharmacy address them, maybe opposed to other things that people have tried?
Right, right. So, anything you can think of, we probably seen it, but the majority of things that we see is a lot of gut health issues. And of course, the gut is connected to every other organ system, especially the brain. So we see a lot of gut health issues. We see a lot of hormone imbalance. I do a lot of work with genetic testing. So getting to how that patient is put together on a very individual cellular level, because they're going to look different from every other patient that we see. We also try to learn as much about that patient so that we can help them better advocate for themselves with other physicians and practitioners as well. I mean, everything from food sensitivities to testing for mold and parasites and that kind of thing. So that's a lot of what we see.
And I am thinking that Dr. Holmes froze. Heather, can you hear her, or is this just me?
Type things. Are you still there? Sorry.
I can't tell who's freezing. Is it you that's freezing or me that's freezing?
I'm not sure.
Okay. So I was asking Heather
I'm
if
not
she,
sure. Yeah, I didn't know what all you heard. I can go back if I need to.
yes, so I didn't hear. Let me see if she gave me a private chat. Nope, not yet. Okay. So you froze from the very beginning of your answer. So go ahead and tell us
Okay,
about yeah,
gotcha.
thank you. Sorry
So
about that.
basically, no, you're fine. The majority of what we see is a lot of gut health problems. That's probably one of the bigger things that we see. A lot of hormone imbalances. We do a lot with things that lead to inflammation. So that could be everything from a food sensitivity to bacterial overgrowths in the gut, SIBO, things like that. We also deal a lot with genetics. So the more that you kind of can understand how you're put together as an individual, the better you can advocate for yourself in general. So those are the majority of things. We do see lots of mental health issues like past trauma, anxiety and depression, things like that. From a functional perspective, typically we start with some deep dive type testing. So the more we can understand about that patient at a very deep cellular level of what's going on with them, the better recommendations that I can make from a functional pharmacy standpoint, or point them in a direction like therapy and things like that that may be beneficial for them as well. It's a very multifocal approach, and of course, nutrition is always involved in that as well. So that's just kind of a roundabout view of how that would go.
And that's why we at Clear Passages are so excited about partnering with you, because
Mm-hmm.
we deal with gut adhesions, small bowel
Mm-hmm.
obstructions, Crohn's issues, infertility, endometriosis, and all of that. It's so nice to have this multifocal approach where you
Right.
have,
Right.
yes, we work with adhesions, and other people are working with other things that are going on.
Right.
So we are really,
Mhm.
really excited to be partnering with you. And everybody stay tuned, because you're going to hear about a special that Dr. Holmes and us are running together this month. Can you tell us, you have all of your experiences between your Western education, your mom being sick, your children, all the patients you've seen. So how have all your experiences shaped you with how you deal with patients, and how you deal with chronic pain and really, really complex conditions? Because I
Gotcha.
I know, because we see people with very complex conditions, and they only come to us after this big, long journey of trying to find the right way, right? So with these big chronic conditions, things that are multi-layered, how do you go about working with all of that?
Well, and I'm kind of in the same boat, and most people show up here once they have kind of waded through all of the common types of treatments that haven't worked usually, and then they're pretty desperate and need some hope for sure to know that there are other things that we can do. And I always tell my patients that, and this is a terrible business plan, but my goal for them is to not need me anymore. So, yeah, my goal for them is for me to point them in the right direction where they can help themselves. And again, that is a very broad approach as far as what may be necessary for a particular patient. We can't put everybody in the same box because we're not the same way. We're not made the same way. My patients know their bodies better than I will ever know their bodies, better than any doctor will ever know their bodies. So, from the history that I've had in working closely with patients for years through Western medicine and then transitioning into functional medicine, how we approach those kind of harsher chronic conditions is we spend time together and we talk about all your options. So that may include things that I can do from a functional pharmacy perspective, from functional lab testing and specialty testing, to what else might be available out there. I'm of the mind that if I cannot figure out what the root cause to someone's issue is, that I will point you in the direction of the next best person that can help you. So, of course, with chronic pain and things like that, we also love to provide some cleaner, more natural. And that may include herbal type supplements. I'm not against Western medicine, so I definitely want to make that clear. I do understand that there is definitely some good aspects of that, and there are certain situations that require Western medicine. We want to make sure that we're supporting that patient and making sure that we're filling in any gaps that they may need dealing with certain Western medicine treatments as well. So again, there's nothing really off the table of what we won't approach. But I think my history in Western medicine and seeing patients just build and build and build more and more medications over the years. And these 3 medications led to these 3 medications, lots of nutrient deficiencies, lots of side effects. I just think that there's a better way for us to do this. And so that is why I left my career in retail pharmacy and went into functional medicine, because this is the area that we start seeing people find true healing and actual hope that their quality of life is going to be better. And that's our big goal, is again, for my patients we figure out that pathway where they don't need me anymore. So, but that's the big goal at the end of the day, for sure, is that they have the best quality of life possible.
And because, first of all, you're addressing or trying to address the underlying cause, opposed to just like you were saying, medication and or even supplement on top of supplement, right? We're trying to find the underlying cause, right?
Right.
And then I really appreciate your comment, because I tell this to all of my patients, because they really want to, well, is my doctor right? Is my naturopath right? Is this person right? And holistic medicine should be whole. It should be the whole container. There's really good things about Western medicine, and they're going to fix my broken leg with a cast and ORAF if I need it, right? And there's really good things about everybody. So if it's holistic, we really take a look at the whole picture, the whole person, and then we use the whole thing that is available to us.
Right. I tell my patients all the time, I was like, what may work for Susie might not work for Sally. So we don't approach everything like, let's do everything the way we did it for Susie, because Susie and Sally aren't made the same way. They don't function the same way. Their lifestyle may not be the same way. Their environment may be completely different. Their toxin burden may be completely different. So again, it's a very individualized approach, but we do look at all of our options so that we can create a plan of action that meets that patient's needs for sure.
I love it. I love it. So I really do. This is really exciting to me. I expect a phone call from me afterwards.
Okay.
You know that we treat conditions like endometriosis and small bowel obstructions, black fallopian tubes, and they're all related to adhesions. So
Right.
what would kind of be your approach to treating from a functional perspective, some of the
Gotcha.
diagnoses that we see?
Right. So a lot of the things that you guys deal with, the first things that I would do is start doing some deeper functional lab tests to make sure that there isn't something underlying that is exacerbating those conditions and making it harder to heal. So from a bowel obstruction situation, we want to make sure that the gut microbiome is as balanced and working as optimally as it possibly can. With the amount of gut type testing that I do, rarely do I see a person who's is functioning the way that it should be. There are lots of issues that Western medicine just doesn't touch on that we can actually see on paper. Here's what we're dealing with, and then how do we treat this and get this moving in the right direction. Probably the biggest issue that I see, which is the root of almost all issues, is inflammation. Where that inflammation comes from can look very, very different from patient to patient. So that spectrum of things causing inflammation takes a little bit of discovery work and investigation to try to figure out. We also can look at a patient's genetics and determine how are they set up on a cellular level to handle things like chronic inflammation, oxidative stress. How do they methylate? How do they detox? All of those different things. So from that standpoint, and then with endometriosis and things like that, we deep dive into hormones, which of course then connects back to genetics and also to inflammation. So those are kind of situations where the more we know, the better. Kind of where we are with treating those particular things from a functional standpoint.
You mentioned inflammation a few times, and we really try to teach our patients some skills to help decrease the inflammation, help turn on the vagus nerve. But that inflammation root cause is really in the gut most of the time, isn't it? Or would you say you said some stuff about genetic components too?
Right. Typically, there's things going on in the gut that are going to lead to a lot of chronic inflammation. How a patient manages that type of chronic inflammation will connect back to their genetics. So that's why we want to know as much information as possible so that we can formulate a good plan to address where that inflammation is coming from. But a lot of lifestyle factors are also involved that we can't ignore. If a patient is sedentary and they're just not moving, if a patient has a really, not great, trashy diet, that's going to play a major factor in how high their inflammation levels are, how well they're going to heal. So again, we have to look at that kind of stuff too. We also look at food sensitivities like gluten and dairy, which we do see a lot of. If you're eating foods that are causing inflammation in your body, then we have to formulate a plan to address that and make some, moderation or elimination type changes to get that inflammation down as low as we possibly can so your body can do its natural healing process.
So if I've never been to you before, what should I expect my first appointment with you to kind of look like, and how long, and what kind of information do you need from me to be prepared for it?
Gotcha. So our first consultation, we call that a discovery consultation, and that typically is a 90-minute consultation, and we will use every second of that 90 minutes. So my goal is to spend time with you so that I can get to know you, so that I can learn about you, so that I can get deeper into just not just what your symptoms are, but what's going on in your life, what your stress level is. I do ask a lot of questions. I mean, it's one of those things where the more that I can know, answer some pretty big information that may change the course of how we approach different treatment options. So that's typically the first deep dive into health history, to family history, to current conditions, what's going on in your life, how do you rate your stress level, your inflammation level. So that's typically the first meeting. And then we take some time kind of at the end of that to really go over all the options that you have and what we think would be the best jumping off point. Typically that's going to be gut health or some hormone testing or possibly even genetics, depending on what's going on. But I like my patients to leave with a really good understanding of what they can do, because everything we do is in their hands. I want them to be in control of everything that they go forward with. So we go over all options, what those testing procedures look like, what we can find out from that. And then I let them make the decisions as far as how we want to jump off. So that's typically what the first discovery consultation looks like. Yeah.
A 90-minute discovery consultation. Can you imagine talking to somebody about your health for 90 minutes? That's wonderful, crazy and wonderful.
We do. Yeah. Mm-hmm.
Yep. So I'm going to introduce and tell everybody who's listening that
Mm-hmm.
we are partnering with Dr. Holmes this month, and we're gifting everybody who books before November 30th a 90 minutes consultation with Dr. Holmes. And then we're also going to give you a gift certificate to buy some supplements or herbs, or to pay for some of the testing that you are going to recommend. So we are extremely excited about this, because we really think that's going to help some of our patients. But
yeah.
How do you feel about partnering with us? And this, I don't know if it's a new population for you or a different population, or is it kind of same old, but how do you feel about partnering with Clear Passage?
Oh my goodness. I'm super excited, because this allows us to form a partnership that widens that multifocal approach for people who may really, really benefit from the physical therapy side of things. That, to be honest with you, a lot of people don't know all of their options. They don't know about Clear Passage. They don't know of the physical therapy side of things that could help with healing. Wonderful opportunity for me and for my patients. But I'm just so excited, because my goal at the end of the day, no matter how we have to get there, is for patients to find true healing and the best quality of life possible. So however we need to get to that place is the boat that I'm going to be on. So
Absolutely. Absolutely. Do you have any insight about how addressing the adhesions through Clear Passage therapy, so working with that manual therapy and addressing the adhesions, how that's going to complement some of the functional medicine strategies that you use?
Right. Yes, absolutely. So addressing adhesions, typically one of the kind of patterns that we see is basically root causes is going to be inflammation. When we kind of dig deeper into it, we do see very commonly H. pylori infections, which many people can have and are causing a lot of inflammation, but they may not be having enough symptoms to be tested for that, or they may have symptoms like reflux or migraines and things like that, where they're just going to the doctor, getting some prescriptions, but figuring out what the root cause of that is just not happening. And then you end up with a more serious condition like an adhesion or an obstruction. And so what we try to do is, number one, put that body in a physical and mental place where their body, it can do optimal healing work. So that in conjunction with that physical type therapy, I think that at the end of the day, your progress and success rates will just be better. So definitely gut health in general. Many patients have lots of problems with their probiotic bacteria. There's lots of imbalances and dysbiosis going on, which just hurts the body's ability to heal naturally, and can lead to enough inflammation where adhesions and blockages are, if we don't fix those problems, are going to be more commonly seen. So yeah, we just got to get down to the nitty gritty of it and see what's going on as a whole. But the physical and kind of supplemental, herbal, holistic side of that definitely complement each other in a huge way. And again, what works for one person may not work for the other. So we want to make sure that we're touching on all of those different aspects so that we don't miss a big part of that.
And we see the same thing in Clear Passage, because the different layers, they get stacked on different traumas, different incidences, different ways people are inflaming. So everybody who comes into Clear Passage gets treated individually and differently than the person before them, because just as you were saying, Susie and Sally are not the same person. So that's really nice that, it's an individual, and that's what we're going for. So you've talked of, the 90-minute consultation, lots of information, testing that's going to be done. How do you empower your patients to make their decisions, to live a healthier life? How do you go about empowering them?
Well, the first thing is just listening, because I will tell you that 90% of my patients need to sit down with somebody who cares about them and is willing to sit there for 2 hours and listen to them. And that's one thing that I think that they have been missing with these Western medicine approaches, is that many people don't feel heard. They feel like they are very alone in the things that they are dealing with. One of my biggest things is to help them to better advocate for themselves outside of the office. But I think that listening and letting them know that my goal is their goal, and we're going to do everything that we can to point them in the right direction and help them better advocate for themselves, but also understand that they are in total control of their treatment plan. If they don't want to do something, we don't have to do it. They have to be in charge of their health, not only within the functional medicine aspect, but once they leave, that's where the work has to be done. Like, I can do so much, but willpower is involved in that. Stress management is involved in that. So again, at the end of the day, they are in total control of this healing journey that they're about to start on. So I want them to know that I am there for them in whatever aspect they may need. And sometimes people just need somebody to listen and to talk to and to relate to. And again, if I cannot be the right person for them, we will find the right person for them.
I love that. Thank you.
Yeah. It's my heart. It's why I left a career that I will tell you, I didn't have a lot of support, because I was leaving a team, and moving this direction was not something that people were used to, especially in the South. Functional medicine in other areas of the country is a little bit bigger, but especially in the South. And so there were some supportive people there, but there was a lot of negativity as well. But when you know in your heart that you need to move in a direction that can better benefit your patients, that was my goal from the get-go. And I have been so blessed and just unbelievably busy from the very beginning, which means that something's working, right? So,
well, and it's a much needed. It's much needed, right?
Yes.
People are flocking to you saying, nobody can figure out what's wrong with me. Help me. Mm-hmm. People really want help. Yeah.
Right.
Oh, so any final words, anything else you'd like to say? And then as you're wrapping up too, please make sure you give us how to contact you and get in touch with you.
Gotcha. So really just thank you so much for this opportunity to reach out to more people. I mean, our where we are in North Alabama, we do see a lot of patients in this area, but we are able to see patients all over the United States through virtual streaming and things like that. So which is absolutely amazing. And I'm just so thankful for the opportunity to be able to work closely with more people and provide those opportunities and options that they might not have known were available to them from a Western or functional medicine standpoint. So how to get in touch with me, I have a Facebook page and an Instagram page with all of my information. It's Farmhouse Functional Medicine Pharmacist. And I also have a website, which is pharmhousefm.com, that you can contact through there. Lots of different ways to get in touch with me. So email, everything. So we definitely can provide different options based on how people like to communicate, for sure.
All right. So Google Farmhouse, we have her website in the chat if you want to look up there. And again, I want to tell you all about the promotion that we are running in conjunction with Dr. Holmes. So if you book before November 30th for Clear Passage Therapy, and I say that, but the last week in November is Thanksgiving, and our offices are closed Thursday, Friday, and Saturday. So we're missing the last 3 days of November. But if you book before November 30th, which is actually like November 27th because of the holiday, we will give you a $150 gift certificate so you can do that 90-minute consult at Farmhouse with Dr. Holmes. And we will also give you a $350 Visa gift card to use towards any supplement or herbs or for any of the recommended testing that she gives. Or you can save it and bring it to your Clear Passage treatment and use it to indulge in something fun for yourself. It's a great, great, great opportunity for anyone seeking to address chronic conditions, adhesions, small bowel obstructions, Crohn's, endometriosis, infertility, anything that you really want some help holistically healing in. So thank you so much. We appreciate your time today.
You're so welcome.
Really appreciate it. It was fun, very educational.
Yeah, me too. And, thank you. Thank you so much.
And then if you want to contact Clear Passage, you know how to get to us, www.clearpassage.com. We have locations, in Nevada, Texas, Missouri, Florida, New York, London, Gainesville, Florida. And just reach out to us if you need anything. But everybody have a great, great Thanksgiving. May you have a peaceful and fun time. We're very grateful for you. Thank you for your time.
Thank you.